Another one of the little articles I saw of yours related to, and I don't remember the exact what you titled it exactly, but basically you were saying like if you take medication, antidepressants and so on, don't read this. You won't like what I'm going to tell you. Can you explain that? Because I take from that you are not a fan of prescribing antidepressants and things like that.
Correct. I mean, it's okay if you're in a crisis, and some people claim they're life-saving, and if that's their choice to do that. But there are so many everyday problems that people just get drugged up for. There's this idea that if you're I'll give you a quick little example. The Diagnostic manual. Have you ever heard of the DSM? It's the Psychology Diagnostic Manual.
Okay.
It has these arbitrary time frames for the way you're feeling. So, for example, the threshold for getting diagnosed with clinical depression is 2 weeks. So you feel down and crappy for 2 weeks, and you go to a practitioner. You might go to your general doctor, who isn't even trained in mental health, and you get a prescription, and you just suppress and drug yourself up. And I've had so many clients where these are processes that you can transform and unfold. When I lived in Switzerland for 10 years, and I worked in a psychiatric clinic, and I saw the people with the worst depression, and we were able to transform it by going into it, not by trying to get rid of it. And the funny thing about this 2 week, as an example, this 2 week threshold is, I've always been curious, like, what mysterious event happens on the 15th day?
Right. What's the make or break? Right.
Like on the day 13, you don't technically have an illness. And on day 14, and suddenly on day 15, you have an illness where you need medication.
Yeah.
Yeah. The overprescribing is obviously such a massive issue through, lots of pieces of medicine, but especially
for sure
talking about mental health, for sure.
But doctor, I got to say, I kind of led you down the path on this because I'm very curious about something new that's happening, and I know some people who are involved in it. And I agree with you that it does make sense that some of these, many of these antidepressants are counterproductive and muck you up rather than free you up. And I know where you're going to come on this, I guess, but I know people now who are microdosing and with acid, or with mushrooms, organic things. And they are telling me after a month, they do 5 out of 7 days, let's say. And these people are saying to me that they have never felt happier or clearer or more focused or more energetic. Any thoughts on that?